Carolyn E. Rossetti. I'm the Chair of Operations Management, Budget, and Government Accountability Committee. This meeting is broadcasting live on HPA-TV, Xfinity Government Channel 96, and Frontier Government Channel 6032. It will also be streamed via HPA-TV.org, the HPA-TV Facebook page, and HPA-TV, Apple TV, Amazon TV, and Roku TV apps. It will also be made available on the HPA-TV YouTube channel. I would like to acknowledge my colleagues present today. To my right is Council President Clark, and on the screen is Assistant Majority Leader Hernandez, Councilman Thomas, and Councilman Mitchell. Our first presentation will be Health and Human Services, and that will be presented by Director Jackson Shahid.
Good evening, everyone. I'm just going to go ahead and introduce myself. I'm Ebony Jackson Shahid, and today I have with me my Deputy Director of Health and Human Services, Jessica Forquette. I have my Deputy Director of Social Services, Patricia McIntosh. I have my MSO, Mohammed Corte, and we have our Julianne Freud for the city. So the Department of Health and Human Services aims to protect the well-being of Hartford residents, to promote an environment conducive to healthy lifestyles, and to prevent adverse health outcomes through needs assessment and the provisions of quality services. So with our organizational structure, we have the director and I have an EA. And then my department is split into two sides. So I have the Department of Human Services and I have the Department of Public Health. And I have two deputies. I have the Deputy Director of Social Services that runs the Human Services Department. And I have the Deputy Director of Health and Human Services, which handles the public health portion of the health department. For the positions that we have in our department for general funds, we have 44 positions. For non-general fund, we have 37 for a total of 81. We're just going to go ahead and go over the department structure or organizational structure for the Department of Human Services. So we have our Deputy of Social Services at the helm, Patricia McIntosh. And so under her, we have Maternal Child Health, which is our WIC program, our MyOp program, and our REACH. We have Senior Services. The Senior Project Manager for that program is Claude Trapp. And we have Community Services, who the project manager or Senior Project Manager for that division is Carlton Smith, and Kimberly May Miller is the Senior Project Manager for Maternal Child Health. Under administration, we have, which is myself, I have directly under me finance. So we have the MSO, which is Mohammed Corte. I have HHS personnel, which is our Principal Admin Analyst, Andrea Cipollini. And I have the Emergency Preparedness Coordinator, or the FEP Coordinator, which is vacant at this time. The department organizational structure for the public health side, we have the Deputy Director of Health and Human Services, Jessica Forquette. And so under her is the Epidemiology Division. We have Disease Prevention and Health Prevention. Health Promotion, and that is the clinic and Ryan White, and we have the Environmental Division. So some of our highlights: Administration Division, we hosted a full departmental summer retreat, which are professional development workshops, team building activities. This is actual annual event, and this is a part of our workforce development plan. We created and implemented a new health education initiative called Hartford Community University. And that is an initiative where we are teaching community members basic life skills for free. Our Public Health Accreditation Board, our FAB, coordination of Departmental Strategic Plan, Community Health Improvement Plan, Website Development, Workforce Development Plan, and Emergency Preparedness Plan. So we are undergoing FAB accreditation where all of this is taking place. We've developed a respiratory health tracking dashboard to provide real-time visibility into illness trends, enabling data-driven decisions for leadership. And we are working on other dashboards for other divisions such as environmental. Our Environmental Health Division, we have the Cosmetic and Salon Ordinance revision initiated. We've spearheaded the establishment of a Policy and Procedure Committee to standardize operational guidelines. For our Disease Prevention Division and Health Promotion Division, we have the Hartford Public High School Public Health Day celebration and other vaccination clinics done by the clinic. Hosted a fall prevention screening event at the North End Senior Center, also hosted by our clinic. The HHS clinic implemented the Alexa-assisted fall prevention program in 4 senior living communities, an AI-driven privacy-focused radar or sensory technology to detect falls and proactively identify risky, unusual movement patterns. The HHS clinic implemented the Tai Chi Chuan movement, also known as Tai Chi, for better balance via a grant from the Connecticut Health Living Collective. Our OD2A, or Overdose Data to Action, hosted 9 Narcan trainings to HHS staff and partners and distributed over 5,000 Narcan units. Our Community Services Division, our Welcome Home Hartford community events. We've had Discovering Hartford, a family fun fair and expo with over 400 participants. Rise and Own, which is Hartford Housing Empowerment Fair, which marked the end of the initiative. Welcome Home Hartford presented 2 key topics at the Connecticut Public Health Association 2026 conference, where we actually presented. The Heart Team, CRT, responded to nearly 6,000 calls since launch in April 2022, supporting the Hartford Police Department and HFD by responding to lower acuity call types. So our Senior Services Division, we assume full operations of the North End Senior Center, processed 5,133 renters rebate applications, began a partnership with Harriet Home Health for the home health services, therapeutic dance that improved cognition and emotion, which is the T-DICE with Yale, extended to both South End Wellness Center and the Hispanic Senior Center. For our Maternal Child Health Division, Maternal Infant Outreach Program MIOP, we are hosting our community baby shower, which is, if you've ever been, it is absolutely amazing, especially for individuals who can't have or cannot afford to have baby showers and or receive the items that they need during postpartum. Women, Infant, and Children, our WIC, reopened community satellites since 2020 closures, reinstituted extended hours. Racial and ethnic approaches to community health, REACH, Family Fun Day, and Health Expo. And we have REACH walk audits to evaluate the safety, accessibility, and comfort of walking environments. And REACH expanded partners to include Heroes of Hope and Food Share. So some of our upcoming events. We have Hartford Community University, which is monthly. We have the Heart Team CRT presentation at the National Conference on Police, Social Work, on Alternative Crisis Response for Elder Residents. For MIOP, we have our 2nd annual community baby shower. For REACH, we have our 2nd annual Fun Day, which is games, activities, and lots of resources. So we are definitely in partnership with a lot of organizations for that event. For strategic initiatives, So we have our full Public Health Accreditation Board targets based on the new federal administration's vision. So we will be focusing on the 2026 vision for FAB, optimizing central location of WIC offices to best serve Hartford communities and surrounding catchment area, update WIC nutrition positions to improve salary parity and retention, strengthening community connections and maternal child health to positively impact birth outcomes and child safety, secure funding to support alternative crisis response program development, and support the Ascend initiative that connects children and families living in the North Hartford Promise Zone with the services and supports they need to reach their needs. So for the budget comparison, for 2026, for total, we have $24,169,792. Of the grants, you have a little over 17 million, and for general fund, we have 6.9. For a fiscal year 2027, we have general fund 6.9. For grants, we have 14.7, and for total, there's 21.7 million. There is a change of 2,429,998. So at a loss of 10.1%, but that is due to the ending of our 2 grants. So some of the significant features here: the department budget increases by 48,225. The increase is driven by union and non-union salary adjustments. The reduction in projected grant expenditures is attributed to the expiration of 2 of our grants. So that is the Welcome Home Grant and the ELC2 grant. And I just wanted to mention that we are currently looking to replace some of those larger grants, and we have recently submitted a few smaller grants to support our existing programming. So a continuation of the budget highlights and areas of focus. We're protecting public health initial services for the health and wellness of city residents, advancing community health with APRN services and public health clinic. We're aiming to improve more ways to apply for additional grants, increase revenue through improved online billing services, improve food licensing and inspection processes, and increasing enforcement of sustainability or sustainable environmental practices such as the plastic bag ban. So moving on to our staff composition. So with our employees, in terms of residency, City of Hartford, we have 30 who are City of Hartford residents at 39%, non-City of Hartford residents at 47, so that's 61%. For race and ethnicity, we have Hispanic, Latino at 14, that's 18%. African American or Black at 42, so that's 55%. Caucasian or white, 11, so that's 14%. And other, 9 at 12%. And prefer not to say, we have 1 for 1%. And for our gender, for our female employees at 62, so 81%. And for the males, we have 15, so 19% of our population, of our employees, are male or have identified as male. Thank you so much for our presentation, and we are open to questions.
Thank you. I will, as I've said in the past, we are going to start with my colleagues on the screen. We're going to do 2 questions each, budget focused, and I will start with, I'll start on the top with Councilman Hernandez.
Thank you, Chair. So I really only have one question. I didn't see much on the strategic initiatives regarding senior centers. I did see one highlight regarding senior centers, which is the TDICE. But can you, Ms. Jackson Chahi, can you or any of your staff speak to the what it is that this year the department is doing to make sure that no senior is left behind? I know last year when we were at this point, we were having conversations about, the funding structure and changes that were happening, for the senior centers, and we were brainstorming on how to maintain that sustain that funding for meals and some of the other services. A year has gone by now, and now I'd like for the public to know what the department is doing to maintain and sustain the same level of service in all community centers, senior centers. I'm sorry.
I actually had some difficulty hearing part of the question. If I can get just a summary of what Councilman is asking about.
So I'm only asking about senior centers and what are the strategic initiatives for this year, since I didn't see any on the slide deck that you presented. What are the strategic initiatives to maintain and sustain the funding levels that the senior centers require in order for them to provide all the meals that they need for every single senior that attends any of the senior centers throughout the city?
Yes, thank you so much for that question. So in terms of the initiatives, first of all, for the senior centers, this year we are definitely trying to improve on the overall programming, activity programming for senior centers. And so, for instance, I know with our shared services that we've started with East Hartford, their programming is amazing. They do a lot of activities for seniors related to health and how to improve health. And so we would like to definitely bring some of that programming to our senior centers and really try to make it more health focused. In terms of the overall funding, whatever funding was given to the senior centers during the budget last year, I believe that that funding will remain for senior centers. So hopefully, and I don't know if you would like a breakdown of each of that funding that is going to happen for this year.
If you can send that via email or provide to Noelia, who should be in the building, that would be great. I don't want to take a lot of time to provide that right now, but please, if somebody can send it via email to me. I just want to make sure that all senior centers will still receive enough meals to provide to every senior. And that's the information that I need in order for me to assess, any future or potential, modifications to the budget. Thank you.
Okay, thank you. We'll send that over. Thank you.
You're done, Councilman?
Yes, thank you, Madam Chair.
Thank you. I will go to the second councilman on screen, Councilman Thomas.
Thank you, Madam Chair. Are you able to hear me okay?
Yes.
Yes.
Okay, awesome, thank you. My only question is, and it's really quick, but could you explain exactly what the community baby showers and also what life skills are being taught, and I think it was called Hartford Community University. Could you just expound on that for me? And that's it. That was my only question.
Sure. So a community university is an initiative that we created out of really just, we've seen needs from members that come into our programs, and sometimes they continuously need certain services, and we noticed that it was a lack of information, really. And so from that, we basically came up with topics that we kept seeing that popped up in some of our programs. So for instance, financial literacy, healthcare advocacy, navigating the healthcare system. And so partnering with some of our community organizations, we decided to offer these mini lessons to the community for free. And not only are they learning a new skill set, but they are also connecting with organizations in a way that if they want to learn more about a specific topic, they can connect with the organization that's offering the services, and then continue to become an expert in that field. So we're really excited about it. We're getting some really good feedback. I think it is telling that, a lot of community organizations are partnering with us and basically donating their time for free. And we see the commitment from them, as well as, what they want to provide to the community of Hartford. And in terms of the community baby shower, this came about, honestly, by us just providing basic needs for our participants. So we have, baby clothes, we have, pack and plays. We offer a lot of these services with participants inside of our MyOp program, but we really weren't doing it on a large scale. And so we decided to partner with healthcare organizations like pediatric dentists and, different specialists that deal with women and children to come out and basically provide their resources or information to the families and, have a good time. So otherwise, a lot of them would not be able to, celebrate or be able to have this grandiose baby shower. So we kind of make it nice for them. We have a photographer that comes out, and we make sure that there is a postpartum gift bag for each family. So they have, elements or tools that they need to take care of their baby. We have diapers. Some of them have clothing. There may be bottles, things that, parents need. And they also have the opportunity to get giveaways. So pack and plays or cribs, strollers. These are things that, otherwise would be very expensive, and we are trying to offer that to our community.
Thank you so much. Is it possible that you could send over some data in terms of attendance? I don't know. Data about attendance, especially for the university, something that's kind of ongoing and happens I would assume in a sessional type of model. If you could send that over, I would definitely appreciate it. Thank you so much.
Absolutely.
Thank you, Councilman. I will now go to the councilman on my left, Councilman Mitchum.
Thank you, Madam Chair. Thank you, Director and team, for the presentation. I was catching some of it in the car, and the rest of it now I'm here. First, what in your request that you initially presented to the mayor in this budget, what did you ask for that you didn't get, both in terms of sheer numbers of dollars and in terms of particular business cases?
So, this is a very complex question. I'd say every year, we usually put lots of business cases in. And, we are obviously not expecting every single case to be granted, because we know that we are, we have budget constraints. I think this year, what we definitely wanted to make sure that we were able to do is, it is no secret that public health is undergoing a financial loss, due to some of the drawbacks from the federal government. And so we just want to make sure that we're still able to provide basic services, the services that we are providing that are a part of the health department, that we can still provide them to the community, whether we're receiving tons of funding or not. And so, you know, really our priority is just making sure that our environmental division is stacked, and also making sure our maternal child health division, especially our MIOP, is in-house. I don't want to say that there was anything that we probably didn't expect that we didn't receive.
I don't quite understand that last part. When you say there was not anything that you didn't expect, that you didn't receive.
Yeah, so I think what we really wanted, I think that's what, you know, or our most important aspect that we were asking for, I think was taken care of. The other, yes, the other asks, you know, everything wasn't funded, but I think what we really prioritized was, and we appreciate that.
Can you, well, actually, I already asked you. I think Julian's going to send me all this stuff, so maybe you don't need to.
Yes, I was just going to jump in and say that we have not forgotten your request, and we're still going to compile that list for you, so.
Awesome.
It's
so
coming.
then my second substantive question, you said that the HEART team responded to nearly 6,000 calls since it started. So 6,000 over 4 years is about 1,500 a year. Can you, if you can, I don't know if you have these numbers on hand, like, can you contextualize that in terms of what percentage of calls of 911 calls is that 1,500 a year?
I'm going to actually let that question be answered by my Deputy Director of Social Services, Patricia McIntosh.
Sorry, Councilwoman Mitchum, can you just explain what you're asking again? You want to know what percentage of the 1,500 is 911 calls?
No.
Okay.
HEART team responded to roughly 1,500 calls a year, which come through the 911 dispatch system.
Right.
What percentage of all the 911 calls is that?
I would have to go back to ES&T and ask for that information, because I don't actually have that at my fingertips, but it's a great question.
I would love if you could pass that information along. And I just one quick question. Oh, you know the answer to that question?
Councilman, I think I have some data from ES&T I'll send over to you that will answer your question.
Okay, that solves that problem. And one related HEART team question. I understood from various sources that the HEART team lost some federal funding, or can you explain to me the state of the HEART team's funding? Let me put it that way.
Yes. So HEART team's funding was $5 million from the onset back in 2020 that was identified for 4 years. So we implemented the team, we started working on the team in 2021, and we implemented it in late 2021 with really them going out to calls in 2022. That funding was all COVID savings and it was a joint initiative by the City Council and by the Mayor's office, the Mayor's administration at the time. So with that $5 million, then right before the end of the last administration, we received $2 million additional funding through ARPA replacement, which essentially is general fund. So it's not at all federal funded at this time, and it has not been. What we found at the end of last year is that we had a choice of reduced programming so that we can continue for 2 years at a reduced programming level while we looked for additional funding, or go strong and steady for another year and then not be guaranteed another year after that and not know what the federal environment or what the environment was for funding. So we chose to reduce funding, looked at the data in order to make that the proper decision around that. And now we are actively looking at how to increase the funding as well as how to expand. We've always had the flexibility to be able to develop and expand the program, so we continue to look at ways to develop and expand the program.
Okay, so just so I make sure I understand, it was always city money.
Yes.
And last year you realized that the city money allotted wasn't quite enough for the volume of I guess, responding to calls that was available, the work that was there. And so you scaled back the work, and we're on that scaled back frame until we can find more money, is that?
Correct, with the intention of trying to, bump up the money over the next year so that we can reestablish stronger, broader hours, essentially. We just scaled back the hours.
How much money are we talking about that's missing?
So the difference right now is it was about 1.4 million initially per year, and then we scaled it back to 870, 868, 304. And we are now looking to make up that difference. So what is that?
Like half a mil.
Yeah, half a mil, a little bit more than that, exactly.
Okay, thank you.
You're welcome. And that would be to bring it to the previous levels. We are still looking at expansion opportunities, and so maybe, and costs go up. So that's all
Let
I'm saying.
me ask a related question in terms of expansion of the service. Do you have a sense of, like, what is the need that you're not meeting for lack of funds? Like, how expansion by how much could it be if money were no object? A thing that nobody around here ever says.
Wouldn't it be great to have a 24-hour response time? So we have 12 hours with 1.4 million. If we had double that, I imagine, it could cover us for 24 hours. We would love to be able to look like comparable programs in the state where we might be able to even go till 2 o'clock or 3 o'clock in the morning. It doesn't have to be 24 hours, but we would love to have more evening hours because we know that the needs during those hours are critical. The meeting that we had today was with EMS and fire. And we're really looking to partner more on the opioid responses because we could really develop something that to better address those needs in our community. And those are largely in the evening hours when we don't have staffing available.
And I'm sorry, I feel like I just want to make sure I understand. So 1.4 million was like where the funding was at, but
Yes.
now it's at 870,000.
Yes. Yes.
So we'd need half a mil to get back to 12 hours
Yes.
and about 2 million
Yes.
total to get up to 24 hours.
Yes.
Okay, thanks.
Thank you.
Thank you, Councilman. Council President.
Thank you, Madam Chair. Thank you, Director and your Deputy Directors and your team that are here. Can you talk about the inspections of the beauty and barber shops and what type of enforcements that you're providing with that and any fines that you've been able to collect on that?
Sure. So we have created a phase plan for the barbershops and salons. We're calling it our cosmetology program. And we have completed phase one, which was basically an assessment of how many salons and barbershops we have in the city of Hartford. There have been lots of businesses that say they're a salon or, they're saying a barbershop, but they're really not, and or we're finding new ones popping up all the time. So we did an on-the-ground assessment for that. The second phase really is about education, so providing education to those businesses and making them aware of the licensing programming and what they need to do to get up to code. The problem is, and why we're doing a revision of the ordinance, is I think that what we are requiring individuals to do to get licensed is going to be quite expensive. With some of that air quality equipment that is needed in these businesses. And so that's why we are looking at the ordinance to possibly revise some of that language so that we can look at the structure, buildings that they are currently in. Some of the locations that a lot of these businesses are in, they don't even have certain type of windows and placements, the way buildings are positioned. They just don't have the proper structure for what we're requiring. So we're trying to set up a different model for what's required for licensing.
Thank you. As a follow-up to that, what areas in the city are more your problem zone areas regarding the barbershops and beauty salons?
We would have to send that information over to you.
Okay, thank you. My next question, since the chair said we only have two,
And let me add to that any council person is welcome to send any questions in writing to the department head, and I'm sure they will answer very quickly.
I won't touch upon the Hart team. I think Councilman Mitchell took all of my notes that I had written down regarding that, so that's good. So as the department is moving to a new edifice between July and October, hopefully, fingers crossed, the MyUp and WIC programs, I know that it was originally slated to be in a different location. Am I assuming now everything is going to be in Albany Woodland now? But because you touched upon some centralized locations within Hartford, so maybe you can expound upon that.
Sure. So originally, when I came on, Albany and Woodland was already in effect for the health department, but our maternal child health division was actually supposed to be located down the street from there. So that location is no longer available to us. So there is another location that is possibly on the table. And so we are trying to get that, outfitted for the needs of our program. However, we're not sure if that location is going to fit our entire maternal child health division. So we're trying to make sure that we could do that.
So essentially it's going to be in 2 locations?
So we really would prefer that there is one location, one centralized location for maternal child health. We want to make sure that it's on the bus line, that it is, there's plenty of parking, and also we, really ideally we would like some outdoor space for, children, and hopefully for us to be able to have events and not have to go to either a community center or, as right now we're using Parker Memorial and or one of our recreation centers for activities. So it would be ideal to use the location that we have, for events.
Are you able to share where that centralized location is?
At this time, it's still up in the air.
Okay. How is the city defining a centralized location?
I'm sorry, can you repeat that?
How is the city defining what a centralized location is? Because I can say downtown is central, right? Since it's downtown, it may seem like it's more in the middle of the city, but how is that objectively discussed?
So in a location where it's easy for people to get to, and between the 2 spaces that we have right now, we would prefer that it's close to the health department. So if the new building is on Albany and Woodland, we would prefer that it's somewhere in that space so that if people need other resources, they can have access to us as well. So hopefully, we'll find a space soon.
Okay. And as a follow-up to that, have you identified within the WIC and MyUp and maternal health what some of the greater needs are and the demographics that may have the greater need versus others that may not?
Let me actually give Patricia the opportunity to talk about that a little bit, and then I can give my input.
Sorry, is this on? Yes, it is on. So thank you for that question. The WIC opportunities. Wow. So WIC is currently, I did want to add to what Director Jackson Shaheed was saying regarding their location. They currently have 2 locations. One's in the south, one's right here on Main Street, and then the other one is at 131 Coventry. So we would ideally like to bring that team together. We continue to have challenges with their location, so we're renting 2 locations, and we were looking for a place where we can put them in one location. That in the last couple of years, they did develop some satellite locations. After COVID, they had closed them down. They were satellites located because they are regional service. They can take anybody who's looking for WIC services. So in the past, we had a satellite location in West Hartford, another in Windsor, another in the north end of Hartford, another in Wethersfield. And so they're just now opening all of these locations again so that they can continue their enrollment. For the past couple of years, they actually were on a corrective action plan because they had reduced staffing. We were having some retention concerns with WIC, and we've worked a lot in the last 2 years to refine how we refine the job postings and do a better job at recruitment and retention. So we are nearly fully staffed right now, have been fully staffed, but we just lost a couple of people. And with WIC, we would say that we are always under-enrolled. We are looking to increase our enrollment, and so really targeting neighborhoods where people are at highest risk for maternal and infant mortality, and that would definitely be our Black and brown communities within Hartford. So we would like, that would be our target population that we're focused on, improving access by being more present in the community and also by having proper staffing. And also, some of what challenges us with the 2 locations is that we only have primary bilingual speakers in the south end, but then when we have Spanish-speaking families on the north end, we're looking to beg, borrow, and steal services, whereas if we were all housed together, we could really manage the staffing and the distribution of work much more effectively. Did I answer the question? Did you also want to know about MyUp, or you're okay with that?
No, I still want to know about MyUp, yeah.
You do want to know about MyUp?
Yes.
Okay. So MyUp, we have... MyUp is a maternal infant outreach program that's been in existence for over 40 years. They provide outreach to women and pregnant and parenting women who are in the community. The opportunities that we see for MyUp is that we currently have been paying the Hispanic Health Council to support the staffing of that program, but we think we would have better opportunity to grow the program if we didn't have to do that. So one of the things that we would like to do is to expand our service profile by bringing them in-house and also helping to enhance the skill set that they have. So developing more breastfeeding peer counselors so that they can provide that service to the community, partnering more with doulas so that they can have that healthy start in their pregnancy and through the early months and years of parenting. We would like to also expand the age of MyUp. Currently it goes to 18 months that we provide services to the families, but we would like to expand that to 5.
And I just want to add 2 more things in terms of areas of focus. We are really focusing on patient advocacy as well. We've had a number of patients, and honestly, I really don't want to tell the stories here because they are devastating. But really, you know, sometimes our residents are going through really tough times when they're pregnant. And so really just, you know, giving them the resources and or giving them the education they need to advocate for themselves is definitely something we're focusing on. And something else that we recently, this is recent for us, is really the Father Initiative. And we are really looking into training our maternal child health staff to be more inclusive when it comes to fathers. You know, I know previously when I managed the maternal child health program in New York that there was a fatherhood initiative, and it was a program separate from our MyUp program, but really it was for fathers exclusively, and we want to bring some of that to the city because we really want to make sure our fathers feel like they are a part of WIC and services as well as MyUp. So that is an area that we are also focusing on.
Thank you for that. The follow-up that to this is staffing. I know that the department has always been a mix of general fund and grants. Are these two particular programs funded through the general fund, or their grant opportunities?
So MyUp is general fund, and WIC is a state, I don't want to say grant. It is a grant. It is a grant, but it's usually non-competitive, and we usually receive the grant. But you know, with all the talk around WIC, sometimes you know we feel like it may be up in the air.
Okay, thank you. Thank you, Madam Chair.
Thank you. Director, kind of a hypothetical. With all the changes, and I'm sure the worry that you have with, you know, federal government, what is the thing or things that you and your expertise kind of perceive as something that keeps you up at night or we should be worried about?
I think one of the challenges that I worry about is our clinic. We've had ELC. The ELC grant was a really large contributor to the programs that we had at the clinic. Our clinic is an STI and TB clinic. Last year, we ended up losing the TB grant from the state. And so the state created a new model for us where we can provide services and then basically we bill the state. So we basically get reimbursed for the services that we provide. And so we really appreciate, the mayor's office setting up something for us financially where we can still provide those services to the residents of Hartford and then get reimbursed. The thing is that previously because it was a grant, we would serve any and everybody that came into the clinic, whether you're documented or not. Because now we are billing and we are billing people's insurance, or you have to actually be qualified for Medicaid, we really are put in a position where we can't serve certain populations. So unfortunately, Hartford is one of the clinics that not only was serving Hartford, but we were serving other towns that did not have TB programs, and they were sending them to Hartford. So I think, one of the things that, we think about is the longevity of our clinic and what services or other services we can provide to make sure that the clinic continues to thrive.
Thank you, Director, and thank you to your team, and thank you for your presentation. And again, if my colleagues have any other further questions, I'm sure the Director and her staff would be happy to answer them. So thank you. Next up is the Parking Authority. And we have our CEO, Kay Almanai.
Is it on now? Okay. Thank you for having us. We're excited to be back again to give you some updates on everything we've been up to this year. Let me get to the front. Hartford Parking Authority mission and vision to provide clean, safe, accessible parking, both on and off street. We strive to be a leader in incorporating industry best practices and be an active partner to the city to promote economic vitality and community support. We're responsible for maintaining, managing, and operating the city's dedicated parking facilities, and we also do manage a few leased facilities that are not city-owned property. So the assets that the Parking Authority is currently managing are 2 city garages, one being the Mac Garage, which is between Main and Trumbull Street, the downtown library parking deck bridge. We have 2 leased assets, which was the old Rensselaer, Polytechnical Institute, so we leased that garage and that parking lot, but those are temporary and they are slated for development at some point. We do also have the 141 Sheldon Street lot, which most of the city employees park in, and we do also have monthly parkers there. We do also have 10 metered spaces as well. We have the San Juan parking surface lot, the High Street lot, Anucello parking lot, which we lump them together and we call them the Dono lots because they're proximate to the Dono area. And then we were asked to manage the Albany and Woodland parking lot once that construction is finalized. Our largest parking asset would be on street, where there is about 1,800 spaces that the Parking Authority manages for the city. And that includes metered parking, residential parking permit zones, and also we manage the valet parking permit program in conjunction with DPW's traffic division. This is the Parking Authority Board of Commissioners, 5-member board appointed by the mayor. We have a chair who is a veteran on the authority, but she is new to being chair as of December 2024, so I guess a year in. Vice chair and treasurer joined us in December of 2024, and we were appointed 2 new commissioners recently in January. This is currently our org chart. As you can see, everything that is highlighted in the orange are roles that are currently vacant. We have 7 vacant roles out of 19 full-time positions, and out of the 8 part-time positions, we have 4 part-time positions open as well. The breakup at the top, I don't know if you can see it, it's very small, but we have 81.8% Latino population, 9% Caucasian, 4.5% African American, and 4.5% Middle Eastern. And for Hartford residency, 22% of the entire administrative and facilities team are Hartford residents. Our vendor, which is probably more frequently who most people interact with, they are in charge of events and also enforcement. 59% of them are Hartford residents, 55% Hispanic, 28% African American, 10% Caucasian, 3.5% identify as Jamaican, and 3.5% identify as Somalian. They've been operating in Hartford for over 14 years now. And they are union, they are part of the Teamsters, the local 671. Some of the services that the Parking Authority provides to the city and the community is that we enforce ahead of sanitation and street sweeping operations to make sure that also there's emergency access for fire and for police, and also that we support the parks, which is going to be something new as of summer 2026, and that was born out of a city parks ordinance that passed last year. So we'll keep everyone tuned on how well that goes this year. We support public safety and compliance through enforcement. We manage residential parking permit programs, which are opt-in only programs in designated neighborhoods around the city. We support snow ban operations to support DPW snow plowing and HPD to clear the streets. Also emergency parking support. So we do manage blue light lot. We do snow removal as well on those assets. And this year, for the first time ever, we actually, because the snow was so bad, we housed multiple times all of the police vehicles from the public safety complex in the MAC garage so that they could properly plow those surface lots as well. So that was a nice partnership and use of the garage this year that historically was underutilized. We respond to community service calls frequently where people are having issues with either neighbors or with local businesses that are encroaching in their driveway or having issues of that nature. We facilitate construction development projects by arranging for on-street reservations. We usually go out before we will grant an on-street reservation, and we make sure with DPW's traffic division that, if somebody does need, 500 days or so of construction to remove spaces, that is not going to be a huge issue for not only the residents, but also for the businesses proximate, and that it is safe. We support citywide events and activities by giving free parking or donating parking or offering parking wherever we can, proximate to our assets. And we do support DPW and HPD with placarding during major events as well and special events. And our goal is to improve access and infrastructure for local businesses, residents, visitors, because we do have the Corporation Counsel's office does appeals in our office. We do frequently hear the feedback, and we are tracking that, and we often do reach out to the partners in the city to make improvements to infrastructure when we hear those complaints. And we are a frontline extension of city services. So there's a picture of some of our staff doing some work to support the sanitation signage updates. Parking donations, this is something historically that we have not tracked in an effort to make better data-driven decisions and to better understand our budget and mitigate for things. We are now tracking. So year to date is the only information we have at the moment, but we have donated over $23,000 in parking already, and we've provided event staff for over 20 City of Hartford and nonprofit events. And that's just a few of the ones that we have done this year. Improving Hartford's infrastructure, we, in collaboration with DDS and the city planners there and the traffic division of DPW, engage with residents, businesses, and community organizations to address all sorts of requests for parking infrastructure improvements, whether that be that there's signs that are faded in certain areas, or whether there's something that, a portion of a city block no longer serves the function of that block. Businesses change, zoning changes for buildings, and therefore the usage changes for the street. So we really try to, hear the responses from the community on how they are interacting with this infrastructure that they have in place at the moment. And we do try to take a fresh look at how can we better serve the neighborhoods, to adapt. For example, one of our most recent infrastructure updates was the businesses on Asylum Street, which are mostly grab and go. We're having an issue where a lot of their Uber Eats and drivers who rely on that income to make a living were getting tickets because they were double parking, because it is free parking after 6 o'clock. So people would come and park at 6 and stay there all evening. And unfortunately, that is a busy time for a lot of these restaurants, which depend on that income. So we partnered with DPW and DDS and put in 15-minute loading zones so that they could better facilitate their grab-and-go customers. And they were quite happy with that. Enforcement of the parks, that's something that we are looking to put signage up this spring and start in the summer of '26. That came out of some complaints from Colt Park that said that they were having, issues trying to get enforcement after hours. So we're a little bit more nimble, and it's a little easier to get a hold of us to kind of get out there to do that enforcement as opposed to having to ask HPD. So we're hoping to, we're hoping that we can help them in a positive way from people parking on the grass and, staying there past dusk. Also, off-street validation programs, we're working to see what we can do to support all kinds of events downtown, and we're hoping to, improve our gating system. Right now, we currently have a very outdated gating system which doesn't really allow for validations and things of that nature unless we physically have someone present to do that. So we are working on solutions there. And the Irving Street RPP program, which we did a pilot for last year, which was a request out of that NRZ. They were very happy with it, and they asked us if we could expand it because they didn't feel that it was overcrowded with the RPPs that were given last year. So we expanded that program, and we also hosted, once again, on-site the RPP renewals at the Center for Justice. So that's going to be an initiative that hopefully, if we can get more staff, we would like to physically, like once a year when the renewals come up, go to either the NRZ meetings or a community center proximate to those RPP zones, so that they don't have the burden of having to come downtown during our business administrative hours, having to pay the meter or find parking, which where our location is not ideal for, and potentially risk getting a ticket. So we are hoping to, either do that later at night or on the weekend maybe, and also come to the neighborhoods as opposed to having to make them come downtown. Improving Hartford cityscape with limited funds. Sometimes the best thing you can do is just some cosmetic updates to make things feel better, more walkable. We partnered with Knox Parks to get some planners around all of the assets, including the surface lots. We also partnered with Elizabeth Park, where we purchased all of the extra plants that they had from their show this year so that we could, put a very nice project together. Actually, our board is going to do a board retreat where they are going to plant them, so that's also very lovely. So I think that just understanding that we can make changes to update things and then also support other Hartford nonprofits that are also trying to do good work, and the money kind of all stays in the same pot. This was another project that we did, which again, was not much you can do with surface lots and fence, but we decided to partner with the Yard Goats. We told them that we'd pay for the printing of the scrim if they would give us their assets, and they were happy to do so. We also worked with them to color code and do a wayfinding system and update all of their maps and such as well, to make it easier for people who are coming to all sorts of events at Duncan Park to find. And also, if anyone's been to the Arrowhead area that's under development, we wanted to just improve the look over there so that it does feel more walkable. So if anyone wants to go, they've already started hanging it up. Go check it out. We also did a little bit of landscaping over there, and we did patch some holes in those lots to support the San Juan Center and those local businesses along Main Street. And also, not just the Yard Goats, but we're partnering with the 9 businesses that are on Main Street right there, and we are going to also pay for the scrim and get all their logos done on it and promote for people to shop as well. Inside the garage assets, we also did a few other partnerships where we had to do some ADA compliance updates, and we used that as an opportunity to make the garage just a little bit more friendly for those coming downtown to come enjoy the arts or enjoy games. So we partnered with the Hartford Stage, and they're providing us their assets. There also is a, around State House Square, a beautiful timeline of the history of Hartford. So we partnered with that firm as well. And if you can see in the middle picture, that is actually a timeline of all the impressive things that have come out of Hartford. And we're hoping that we can use the garage as a showcase to, let people know that Hartford is cool and you should come downtown and enjoy it. And there's a lot of history here and kind of gives them something to look at as opposed to just concrete. So also the photo with the map in the elevator lobby area, that was a partnership with the Hartford Bid where they also gave us those assets for free in exchange for the fact that we paid to print them and get the room painted. And that is actually an interactive map. So if you take out your phone and you scan the QR code, it will take you from exactly where you are to any of the assets and landmarks that are on that map. Additionally, you can't see it in this picture, but there is a wall that has a list of all the things that the bid provides, which is if you have a flat tire for your bike or have a flat tire for your car, they will actually come and help you with that. They will also help you jump your car. So those are that service list. We also listed in the garage near our bike rack and near our near all the vehicles, so people can know that they have those amenities accessible downtown. Also, at the bottom, you'll see we have a little air pump with a free sign. One of our commissioners was very passionate about getting free air pumps for bikes or for, just anyone to use. So we're hoping that we can this year install some of those in the library and also in the garage. Speaking of improving city assets, one of our biggest lifts this year has been the Mac Garage, the Main and Trumbull block under the Stilts building, connected to 280 Trumbull, next to the Hartford stage. It's in need of about $55 million of total renovation, but the safety and security things that are really necessary were about $7 million. So we were priced out from the times that we initially had condition reports, but what we did is we were able to break that into 2 phases. So hopefully by the time that they're done with phase 1A, we're calling it now, we can find a way to either self-fund or come up with the other half of the money to do the rest of the project. But that has been totally funded. We've already have the full construction docs. It's gone to procurement and it is about to be awarded. So that is going to happen hopefully by this summer or before summer even, that we're going to get that project going. There was also a stairwell that was shut down right next to the elevators, which was a safety concern. And we were able to work with CIP and DPW on that, with that as well, and get funding to make sure that we can get that done. And we put that out to bid with this project, so we were able to have a little bit of cost savings, making sure that it kind of went out at the same time and it was all bid on at the same time. The library parking bridge, we had brought it up last year that we receive annual condition reports every year, and in those reports we did get notice that the DOT deemed that bridge in critical condition. That being said, there was about $7 million of repair that need to be done to the bridge. From a structural standpoint, there was sort of an issue where DPW came up with the money, got the full construction docs done, applied for the local bridge program with the DOT. We were eligible and on the list, and then they reversed that decision, stating that the definition of a bridge does not, this bridge specifically does not fall within the definition of a bridge because it does not take you from point A to point B. So the mayor's office has been great advocating for a change with the legislature on the definition so that we can possibly get the bridge back into that program, which would mean that the DOT would cover half of the money required to fix that bridge. We've continued to do operational audits, improvements, and identify cost-saving initiatives. We have significantly reduced our costs by just, partnering with the city, leveraging city contracts, And that's been a tremendous help for us. It's also helped us with uniformity, so that we're kind of all using the same systems. So also holding our vendors accountable, really going through their contracts and understanding what level of service we should be getting, and then, demanding that, or seeking the financial recuperation for what they have not been able to fulfill. We've also delayed the relocation of our offices. Our lease was up last year. We did do a one-year extension. It's not ideal for those visiting our offices. There's not really a place for people to park. We are a block and a half or almost 2 full blocks from our offices, so that requires our staff to have to walk back and forth, which loses a lot of time operationally for them to be able to carry out the work that they need to do. So we ideally would like to move closer and more proximate to our garage, one of our garages where we house our fleet, and then that will also allow us to validate parking for those who are coming to visit or come for hearings or RPPs or whatever, what have you. Some major expenses that we incurred this year. We had very, very cold winter. We had about $282,000 just between December and February of pipes freezing and bursting. We had unexpected snow removal costs, which, we did not have budgeted for as well. Also, the union contract fell within this fiscal year where there was an increase of wages, and that's probably one of our heaviest increases to the operating budget. We had some unexpected legal and compliance matters that arose, and then also there was an oversight on an IT expense for a software that previously was an agreement was signed for that I inherited, and that was about $120,000 off per year. So we made those adjustments in this budget for this year. I think that might be, oh, I went the wrong way. Yeah. It went. There we go. I guess that's all. It's not coming up, but that's fine. Thank you.
Okay. I will thank you for that. I will start with my colleague on the screen, Councilman Thomas.
Thank you, Madam Chair. Thank you for the presentation. I don't have any questions. I yield my time to the rest of my colleagues. Thank you so much, Madam Chair.
What did he say?
Okay, I will now
I'm
start.
so sorry I missed that. No questions?
He had no questions.
Yeah, I don't have any questions.
Thank you.
Are you able to hear me okay?
Thank you, Councilman
Yeah,
Thomas. Thank you. I will now start to my right, Council President.
Thank you, Madam Chair, through you. Thank you, Kay, for your presentation, and to some of your board members that are sitting behind you. Talk about city assets, well, Hartford Parking Authority assets. Have you done an analysis as to maybe back a decade, how many HPA assets were in the city and what that yielded in revenue as compared to now?
I did initially when I was the finance director 2 years ago, so I can't give you the exact number offhand, but I do know that the city did have Morgan Street Garage, Church Street Garage, and the Dono lots surrounding Duncan Park.
And based upon that, an estimate, how much was it in revenue that the parking authority was collecting and was able to give to the city?
So when I looked back in, I believe it was 2006 and 7 era, the parking authority passed the operating budget, was giving back to the general fund $6 to $7 million annually.
And based upon this budget, how much is it now?
In our board-approved budget, we are recommending $102,000 back. In the mayor's recommended budget, he is asking for about $900,000 back. And last year, we gave $1.2 million back.
So in your time with the Parking Authority, what's the vision between you and the board that you've come up with that actually can look for more revenue?
So I think step one initially is to cut operational expenses and get as lean as possible responsibly. There are a lot of ways that we can save money. We've identified multiple cost savings that we could make changes and save about $200,000 a year just by partnering with the city. One example of that is if we're already named insured on the city's insurance policy for fleet, and if we would move our fleet over to the city, not only would we be eligible for gas from DPW, which we would pay for, but it would be we're not paying taxes through our vendor, but also we wouldn't have to pay annual car taxes through our vendor, registration through our vendor, and we also would be able to insure the vehicles at no additional cost to the city, and it would save us $65,000 a year just in the insurance expenses. And there's a couple other things that we could do operationally to kind of get our expenses as low as possible to make room. And then from there, growth initiatives that don't necessarily mean creating new parking, right? It could be that we actually bring some of our rates to market rate. We have garage rates that have not gone up in over 10 years, and it costs more money to maintain the garage than it did over 10 years ago. So just building in those slight increases, and then also monetizing revenue through other uses of surface lots, creative things. We've had requests to do fashion shows. We've had requests to do car shows. And I think that those are ways that we could do pop-up food truck festivals, things of that nature, just things that we can do that don't necessarily have to traditionally weren't what parking facilities were used for, but creative ways that the city can interact with these assets and also generate revenue creatively, yeah.
In your estimation, would it be feasible for the city to look to build a new parking facility?
Financially?
Yes.
Is the parking authority funding it? I think that there is a case study for it, right? So the city relied on revenue bonds from the parking authority to build Morgan Street Garage, which they then were also later able to sell, right, to make money. So I think that there is definitely precedent for the parking authority being used in ways to help develop and fund assets. I think the Mac Garage renovation project is a perfect example of that. We're not required to do capital projects. It's not really within necessarily our purview, but the board at the time and myself and working with everyone thought that it was important that we use the R&R reserves that the parking authority had to help lift those projects, particularly in a bonding freeze, so that we wouldn't be priced out of the renovations getting higher and higher, and also so that we could secure this asset that is a revenue producer for the city in perpetuity for the general fund.
Okay, thank you. Thank you, Madam Chair.
Thank you, Councilman Mitchum.
Thank you, Madam Chair. Thank you for the presentation. Just quickly to follow up on your answers to Councilman Clark, you said that the board's recommendation for money back to the city is 102 grand and the mayor's is 900 something, I think you said. Why the discrepancy? Explain that to me.
I don't know what the discrepancy is because there was no changes made to our proposed budget. I think that there was just a request that we give back $900,000. I think that we look at this as a collaboration. So, if we can cut back in further ways, we're going to try to do so. I've been working with my finance manager for a couple months now on how we can kind of even close that gap even further, and I've identified a few things that, you know, that we could stagger, whether it be hiring delays or things of that nature, to kind of help bridge that gap. So we're down now to, I believe, like a $262,000 gap that we're still looking to close. And I think that, you know, with a little bit of support from the city perspective on getting our operational expenses a little bit lower, by, you know, merging some of the expenses we have with city, jumping on city contracts that are already in place, I think that we can close that gap even further.
Actually, that gets to my second question, following up on Councilman Clark's question. You said that there were some cost-saving things, like moving your fleet to the city's fleet management. Is that just something that has to be negotiated with the city? Is there any action the council, like, is there money involved in the budget? Like, what needs to happen so that can happen?
I believe that it would have to be approval from the mayor's administration, I think the COO's office, Department of Public Works. We do already have 2 vehicles that are registered with the city and city assets, but I think what makes it, why this has become a more pressing issue recently, is that we have paid off the fleet that we had been you know, making payments on about a year ago from the vendor. So this is a new opportunity now where we actually could register the vehicles under the city, like we have 2 other vehicles. And I believe that it would just require the mayor's administration to allow us to make that move.
And then, thank you. And then, so my question that doesn't have to do with Councilman Clark's question is concerns enforcement. And I asked this of your predecessor last year. I sort of, you know, what I observed, like I live in Parkville, I live right off Park Street, up that end of Park Street. But what I observed going around the city is that there's not, like, I see a lot of enforcement downtown around, like, the street spots, but very little enforcement in, like, other commercial districts when folks, for example, in the C-Town on Park Street, that back lot at C-Town on Newton Street will be empty or have many spots, but people double park in the front to go do their shopping. And I'm neither here nor there on it, except it makes the street too narrow and it becomes dangerous for traffic and people crossing the street. That's one example that I see all the time because it's by my house. And I guess I continue to see that there doesn't seem to be very much enforcement out in the neighborhoods versus downtown. Is that like a strategic decision because of the revenue that comes from it, or is it just why is that so?
So really what it is that we are very, very short-staffed. During COVID, there was no enforcement on meters, so we're still building back our workforce post-COVID, and we really haven't had strategic budgets previously to kind of give room for us to grow into that year after year, which is why you see that there is an increase. There's also a union increase, right? So in order for us to be able to provide enforcement in all of the areas, I mean, we have 12 full-time enforcement during the daytime to cover the entire city, and they're humans and they have days off and they have children and they can't. So, you know, sometimes when the weekend's happening and there's an event or something, it really makes it hard for us to be everywhere. We also receive calls where we're asked to be certain places, right? So it might have been that we have to go where we're called. And I think that what you're seeing with the emphasis on downtown is really just requests of the businesses. So a lot of the businesses would prefer that, you know, we're there during their business hours to keep turnover. That's essential to them being able to, you know, have customers access their businesses. So we do try to go a lot of times where we're wanted and where we're called, but we ideally would like to be more uniform in the beats, so to speak, that we do have citywide, especially with this parks ordinance. You know, we've already been getting calls from the parks like, we would love if, we have softball on these days and the people are parking on the grass on these days and, it'd be, when there's a lot of games going on, could you be present? But we are struggling to, even just keep up with just the main areas as it is, and respond to calls, very frankly. Yeah.
Thank you. And actually, one last thing. You probably remember from years past, there had been an informal moratorium on the enforcement of parking and bike lanes for about a year, and I know that's over. Are there any other informal moratoria currently in effect? In other words, not that there's been a change in the rules that say where you can and can't park, but that someone in city government just said, we're not doing this for now?
No, and I think that I've actually been in discussions with leadership and a couple other people. I was appointed in February, so this is sort of my chance to kind of, get things maybe the way that I see them working ideally. And I think that there does need to be a formalized process for when there needs to be review, right? We are not the traffic authority. We are not Department of Development Services. I'm not a city planner. I don't have one on our team. We don't have a city and traffic engineer. So I think the idea is that we're the ones doing the enforcement, and we're not the ones making the rules. And I think that we hear the feedback so we can be valuable in providing that feedback to, the people who've conceptualized it, because we're seeing it play out in real time. But I do think that there is a world where there is a better mechanism for where we hear the either the feedback or the complaints or the requests, and then we have a forum where we can communicate that to the powers that be that make those decisions. And then there is a formal process where it is, okay, there's X amount of time from the time that we receive a complaint to when we accept that we will review it. And then there will be a temporary 30-day, suspension until this can be worked out, or something to that effect. So I am definitely in favor of there being some clarity on the process and how we respond, because outside of the issues last year, it's sort of been a little bit informal in how infrastructure updates are done in general. And I would like to be able to tell people the same answer, whether it's a business asking for it, whether it's a resident asking for it, whether it's, somebody trying to do construction in the area. I think that more clarity and, more laid out defined process and rules for these things would help in a great way.
Thanks.
Thank you, Councilman. First of all, thank you for the presentation. Thank you for some of your board being here. Couple of things. I think some of the reason, and I'm going to sound like a broken record for people who've heard me say this, as someone who was around when the parking authority was formed a long time ago. Yeah, I've been around that long. We wrote in stone. No. I think some of the reasons we're in this position is because they were formed to manage the garages, and they've grown into, not saying it's not important, but they've grown into what they are without maybe the balance of how that would happen. So I think that's a part of it. The other part is usually there's a budget in the presentation. Do you have one of those? Every person presents has a budget. Could you send that to us?
Oh, absolutely, yes.
Okay, because it's not in the presentation. And I also want to thank you. I know you've just come in. The balance of trying to be neighborhood friendly, understanding you have a vendor that does the enforcement, but they're also an entity where we make headway with an organization that people can hate, and then we get better, and then we hate them again for reasons that don't have to happen. And I appreciate you focusing on that. I did hear you say, and it was somewhat ironic, that parking isn't ideal for people to go to your office to. So I hope you can find a better space. But that brings me to, in the last, I know you mentioned to me at one point, and maybe we don't want to talk about it here, how to take over Main and Asylum lot.
I'm sorry, a little louder.
How to take over the Main and Asylum lot?
Yeah, I mean, we hear the complaints constantly about that lot. It comes up everywhere. Even before I worked at the parking authority, I am a Hartford resident that lives right there. So it is an eyesore, and I think a not great use of that space from a citizen perspective. But I think that would require, I've had some preliminary conversations, that is owned by Conover. I know that, and managed by ProPark, and I do know that DDS has attempted in the past, I don't know to what extent, to, work on that, but we would 100% be behind whatever, efforts there are to either repurpose that space in any sort of way, or if even that means that we are managing it, because at least then the revenue that comes from that does go to the general fund directly, and at least it does benefit Hartford in some capacity, even if that means that we receive the revenue so that we can eventually do something else with it and repurpose it for that.
And on that, again, I am been around so long. It was supposed to be a hotel, and it really is somewhat of a shame and an eyesore that a major parcel on a main thoroughfare in a capital city is a parking lot. And I love parking, don't get me wrong, but really it should be developed. But that's my soapbox, and I'll stop. And with that, if there are no further questions, there are none. Very good. That will be the end of the night, and this meeting comes to adjournment. Thank you.